Hello everyone, welcome to my YouTube channel. So let us discuss the quiz which I have posted on Telegram on 4th of May. And every day I am posting the quiz on my Telegram channel, that is Medicine Made Easy by Dr.Rajesh Gubba. And on the subsequent day, I am also giving you the discussion of that particular quiz. So join my Telegram channel for everyday quiz discussion. So the first question is, dense hemiplegia occurs due to occlusion of the anterior cerebral artery, middle cerebral artery, posterior cerebral artery, and then the temporal artery. So the answer in this question is the middle cerebral artery. So there are two explanations why the dense hemiplegia you will get because of the involvement of middle cerebral artery. First and foremost, the middle cerebral artery, it is an end branch, right? Or it is the terminal branch. There is no communication between the right and as well as left circulations. You take anterior cerebral artery, the right ACA is communicated to the left ACA through the anterior communicating artery. And for posterior cerebral artery also, you have the posterior communicating artery. So they form the anastomosis, which is nothing but your circle of Willis. But the middle cerebral artery, it doesn't have the communication with any of the other vessel. So it's a terminal branch both on the right and as well as the left. So whenever the MCA is whenever the MCA is blocked, the individual will develop the dense hemiplegia. That is one explanation. The other explanation you need to know that is this middle cerebral artery, where it supplies is, it supplies the motor fibers at the level of the internal capsule, right? So in the internal capsule, you have the anterior limb and as well as the posterior limb. And in the posterior limb, right, in the posterior limb, there is presence of the motor fibers. And whenever this internal capsule is infarcted or whenever it is damaged, then the individual develops what is called as the dense hemiplegia. So why is that? Because the posterior limb of the internal capsule, it contains the motor fibers, and if that is being damaged, the individual will develop dense hemiplegia, and this part of the internal capsule is being supplied by middle cerebral artery. So dense hemiplegia occurs due to the occlusion of the middle cerebral artery. Now you see the next question. Classical triad of meningitis consists of all of the following except. The options are headache, fever, irregular respiration, neck stiffness. So headache will be there because it's meningitis and it is the raised intracranial pressure which will cause the headache. And it's an infectious pathology most of the time. So fever also will be there. And in case of meningitis, the meninges which are present surrounding the brain will also continue down surrounding the spinal cord. So surrounding the spinal cord, they are continued from the brain, that is within the head. So whenever you try to flex the head of the individual, there will be neck stiffness. So neck stiffness is also part of the meningitis. And what are the differential diagnoses where you can have the neck stiffness? You can also have neck stiffness in case of the subarachnoid hemorrhage. You can also have neck stiffness in case of the cervical spondylosis, okay? But the one which is not the part of the meningitis is irregular respiration. So irregular respiration is not seen in patients with the meningitis. And moving on to the next question. Right, the Cushing's reflex in raised intracranial pressure relates to all of the following except bradycardia, hypertension, irregular respiration, then the hypotension. So Cushing's reflex is the one which gets activated whenever there is raised intracranial pressure, and the components of the Cushing's reflex will be bradycardia, hypertension, and as well as the irregular respiration. And what type of irregular respiration that you come across in case of the Cushing's reflex is, it is the Cheyne-Stokes respiration. That is the irregular respiration that you will come across in patients with the raised intracranial pressure. And this Cheyne-Stokes respiration, that is an irregular respiration, it is not only seen in case of the Cushing's reflex, it's a part of the Cushing's reflex. So any condition which is causing raised intracranial pressure, like for example, you take the brain tumor, right? There can be Cheyne-Stokes respiration. Stroke can cause the Cheyne-Stokes respiration. Traumatic brain injury can cause the Cheyne-Stokes respiration. So because in all these conditions, there is raised intracranial pressure activating the Cushing's reflex, and the irregular respiration is seen, that is Cheyne-Stokes respiration. But which is not the part of your Cushing's reflex is the hypotension is not the part of the Cushing's reflex. Now you see the next question. diagnostic procedure of choice for viral meningitis caused by enterovirus is PCR from CSF, RT-PCR from CSF, IgM antibody from CSF, gene expert. So what is the investigation of choice for viral meningitis caused by the enterovirus is, that is RT-PCR from the CSF. Now how do you treat this enterovirus? So if you see, there is no specific treatment as such, but there are some antiviral agents which have been found to be active against this enterovirus. What are those antiviral agents? That includes number 1, ribavirin, then we have pliconazole, then we have pocapavir, right? So you see these 3 drugs, ribavirin, then pliconazole, and then pocapavir. So these are the 3 drugs which are acting as antiviral agents against the enterovirus. So that is about the enterovirus, the investigation of choices, the RT-PCR within the CSF. Then mollaret meningitis is due to HIV, HSV, Epstein-Barr virus, cytomegalovirus. So mollaret meningitis is the one which is caused by HSV2, that is herpes simplex virus 2 is the one which will cause the mollaret meningitis. And apart from the HSV2, even some other viruses also are implicated in the development of mollaret meningitis, that is the enterovirus and then the varicella zoster virus. Okay, so these are the 3 viruses which are implicated in the development of the mollaret meningitis. And at the same time, you need to know what you understand by the word mollaret meningitis. Mollaret meningitis, it is also known as recurrent benign lymphocytic meningitis. As such, it is not very common. This is a very rare form. And what will the CSF show? The CSF will show you that there is increase in the lymphocyte levels. And what about the clinical features? The clinical features will be similar to that of meningitis. So mollaret meningitis, it is also known as recurrent benign lymphocytic meningitis, which is a rare form, and the clinical features will be the same, that is fever, headache, neck stiffness, and meningismus. And if you take this features of meningitis, they last for nearly around 2 to 5 days and it resolves spontaneously without any specific treatment. Then how do you diagnose this mollaret meningitis? That is by your CSF analysis. The CSF analysis will show you that there is increase in the lymphocytes and there will be also increase in the protein levels and increase in your WBCs, and the WBCs which are being elevated is the lymphocytes. So it will be lymphocytic predominance similar to that of your tubercular meningitis or the viral meningitis. Now, is there any role of the antiviral medication? So usually the treatment is supportive treatment, that is symptomatic treatment. So antiviral medication may be considered if there is suspicion of specific viral infection such as the HSV2. That is the point when you need to give the antiviral medication. So that is about your mollaret meningitis, the one which is caused by your HSV2. So these are the questions for the today's quiz discussion. See you tomorrow again. Thank you very much.